Hi, this is Dr. Ginger Bratzel, and we're continuing on with our last part of the 6 ways to increase new patient conversions instantly. If you have not gone back and seen the other part of the series, we've talked about 5 other ways that using assets and investments you've already made in your practice to increase new patient conversion. Some of them are so easy to do and implement, and some of them will take a little bit of work, but it's not going to put you out of pocket. And instead of investing in another piece of expensive equipment or another gizmo or gadget, I would urge you to do these things first, because these are the basics, the golden rule, things for making success. These are common factors I see in successful practices repeated over and over, and these are the secret ingredients that helps them get more new patient conversions. So let's go on to number 6, and this one I cannot stress enough. Just because it's number 6 does not anyway indicate its importance, but it's making people comfortable. We are in healthcare. We use sharp things. We use anesthetics. We use all kinds of things with a better intention in mind. But to the patient, this is the number one thing they're afraid of. This is why they haven't stepped up to the plate to choose more care earlier, or this is a limiting factor for a lot of them in proceeding. And if this obstacle can be overcome, there's much benefits to your practice, and then we're going to go through and talk about that. 80% of doctors really think they are pain-free, but if you ask patients of those same doctors, only 13% of the patients would rate their doctors pain-free. That is a sad number. You think you're doing a good job. We think, I'm going to put me in there too. We think we're doing a good job. There's a certain amount of implications, a little discomfort in some procedures. We know that. But justifying that to a patient and perception of the patient, realistic or not, is number one reason why people don't follow up with care. Also, this will affect your referrals. So there's steps we can take to be pain-free, and we're going to explore those. Research also shows us patient comfort and overall outcome is related. When we individually interview a patient, how was their pain level handled during the procedure and post-procedure, and then ask them about how happy they were with the procedure, the results of the procedure, those numbers are correlated. If they tend to be unhappy with how their pain was handled and their comfort level, they're unhappy with the level of care, and the referral levels go down for that. This can be a number one internal marketing tool in all the world. You can be the best surgeon in the world, but if you're cavalier and disregard patients' comfort, then you are doing a disservice not only to your patients but to your profession. And I strongly believe that, and I could say that and put it on a pillow and have it embroidered on a little wall plaque. So pain-free, which we should call pain-controlled or comfort control, is number one thing in my book for patients. So we already talked about it being a number one marketing tool. The number one reason things are not under control as far as discomfort level is a lot of times it's because we are in a rush. We got into some bad habits to save some time. We might be having a bad day. It comes across the patient, and not necessarily a bad day. We might not be having a great day, and that comes across to the patient. They're going to get the end of it. Our team members who are administering anesthetic on our behalf, who are putting in lines on our behalf, they have to adhere by the same thing. They might be technically certified to do that, but are they competent? Would you want them treating you? And you might be a tough guy or gal, and you can say, I can handle it. But I recently was at the dermatologist's office, and it was one bad experience after another. This doctor was highly recommended, but the staff was falling apart left and right. They blew it from the phone, the front desk. They blew it all the way through. And we decided to go ahead and have a mole biopsy. And she had a person come in, didn't even introduce her. I don't know who she was, Tom, Dick, or Jane. I don't know nothing about her. I don't know if she's even certified to do it, to give me anesthetic. There was no transition between the doctor and the staff member were never in the same room together. They were running around like chickens with their heads cut off, and that came through. And she just laid on that plunger and pushed the anesthetic in there. And I was trying to be really still, but I winched a little bit, and she said, yeah, these just hurt, don't they? And I said, no, they don't have to. And if you want someone to show you how to do that properly without hurting someone, I'd be glad to come back next week on my day off and we'll go through this, because that was unnecessary. And I let the doctor know that. And so we had another person in the office do another procedure on me, and there was no pain level with that. Same area, everything like that. So someone was in a hurry and having a bad day. If you don't have loving, caring people working for you, then they should not be in healthcare. I strongly, strongly believe that. And it's our job as professionals not to let this happen. Do not hire these people. Let them work at Walmart or the mall, or let them be a cop. I don't care what they want to do, but don't let them touch people. Everyone in the office should have routine refresher training on how to be pain-free, what techniques are available to them, review existing techniques, and practice on each other and tell each other what you feel, because feedback's wonderful. You know, some patients might be wimpy, but your staff members will let you know. I had some cosmetic dentistry done by a colleague of mine, and it hurt. And she said, well, I don't normally give anesthetic for this part. And I mean, it really hurt, and I'm not a weenie. And I told her that, and she said, some guys complain, but I thought they were just being wimpy. And so she went back and reevaluated some protocols and systems in her office, and did some things slightly different. So the best way to find out is to work on each other. And the other thing is just to slow down. I mean, we're all busy. We're always trying to be productive, and we're going to talk about that too, about things to be more productive and get more done in the day. But when it comes to patients level, slow down. You need to relax so they'll relax. And when everyone's in sync, things go a lot better. So we've gone through the top 6 things. I promised you 6 ways to increase your production, but I've thrown a bonus one in number 7. This information, 1 through 6, means nothing unless you do something with it. So if you're not going to use this information, you're not going to use this knowledge and not implement it, then you have no one to blame but yourself. I'm giving you effective, honest, encouraging, proven techniques, but it's your obligation to yourself, to your patients, and your family and friends who rely on you, who you do this for too, because you have a life outside of this, to get this information and use it so you can improve that. And your team deserves it too, because they deserve to go as far as they can in their profession and through your office. And by doing this, you're helping them out too. So take everything 1 through 6 and just do it, as Nike says.